this is Dr. Kanan Jhaveri, consultant OBGYN, obstetrician and gynecologist, as well as I'm a mother to 2 kids. Welcome to my channel where I'll be sharing some practical tips and insights around pregnancy, fertility, contraception, preconception, sexual problems, menstrual problems, menopause, in general everything about women's health. So today I'm planning to start with a topic that is very common in my day-to-day practice, and that is problems with periods. I'll be addressing some very commonly asked questions by my patients. So here we go. Question number 1. What should be the normal length of a menstrual cycle? The textbook answer to this is the average length is 28 days. However, the range varies from 21 days to 35 days. So even if you're getting periods every 21 days, it is normal, and even if you're getting it every 35 days, that is normal too. But here, let's understand how do you calculate the length of your cycle. So the first day of your cycle will be the first day of your periods, whereas the last day of your cycle will be the day just preceding your next periods. Right, so if you're getting your periods say on Jan 1st and then again on Jan 29th, then your length will be 28 days. Right, here I see many people make the mistake of calculating the gap between the 2 periods as the length of the cycle, so that is incorrect. Also, many patients come to me complaining that our period dates keep on changing. For example, in Jan it was 28th, and then in February it was 26th, and in March 25th, and so on. So girls, let's understand here that maybe if your period length is 28 days, but then the calendar months are always 30 or 31 days, right? So naturally they are not going to coincide. Also, let's understand that many factors influence your cycles. For example, your stress levels, your emotions, your sleep routine, your diet routine, your exercise routine, and so on. So 2-3 days here or there every now and then is completely okay. Question number 2. When should I see my gynec if I feel that I'm bleeding heavily, or what are heavy periods? So let's understand what is normal amount of blood that you pass during your periods. That is 20 to 80 ml. Right? So this is an 80 ml cup of water, right? But during your periods, how are you going to collect your blood in a cup and measure it, right? So let me explain practically how do you see that. So guys, understand that any amount of bleeding that is actually bothersome, right? For example, I see many patients wearing a tampon plus a pad, or 2 pads, like a cotton one above and the regular one below, and so on, then that is called heavy bleeding. Also, practically, if you are changing your tampon or your pad every 3 hours or more frequently than that, then that is definitely considered as heavy bleeding. On an average, using more than 10 fully soaked tampons or 10 fully soaked pads during your entire cycle, then that is called as heavy bleeding, right? Also, let's understand that the average number of days that you bleed for is between 2 to 7 days. So even if you are bleeding normally, like changing 2 or 3 pads daily, but then if you're bleeding for more than 7 days, then that is also considered as heavy. So please do visit your gynec if you are suffering from such problems. Question number 3. Is passing clots during a period considered normal? So let's understand that depends on the size of the clots that you are passing. Anything above 1 inch in diameter is considered as abnormal. Now see, our blood has some clotting factors, right? When you get a cut or something and you are bleeding, then it will stop by itself in some time because your blood gets clotted, right? But in menstrual blood, what happens? There is a presence of certain chemicals called anticoagulants. They act upon your blood and prevent it from clotting. But when you are bleeding very heavily, these chemicals, these anticoagulants, do not get enough time to act upon the blood, and that's how it results in formation of big clots. So that comes into the category of heavy bleeding. But passing of some small clots or like tissue fragments or shreds like things every now and then is completely normal, because along with blood you're also shedding the entire endometrial tissue, right? Also, let's understand that the shape of our vagina is like this. So there are plenty of corners or crevices, you can say, where the blood tends to accumulate. And when it gets accumulated, it gets clotted. And that clots will pass only, when you change your position or you go to pee or so on. So if you're experiencing some brownish discharge during the beginning or at the end of your period, then that is completely normal. Question number 4. When do I need to see my gynec if I'm suffering from pain during my periods? The answer to this is very simple. Any amount of pain during your periods which does not allow you to perform your routine activities, or you have to take a leave from your college or school or job, whatever, then this is not normal. Please do see your gynec for the same. However, a little amount of pelvic discomfort or heaviness or a few cramps every now and then during your periods, they are completely normal. So why do you experience pain? The reason is there is a presence of certain chemicals called prostaglandins in your bloodstream during your periods. They give you the pain. Also, when you're passing the endometrial tissue out of your uterus, right? So you get some mini contractions of the uterus, like mini labor pains, and those result into you feeling the cramps, right? But yes, if the pain is very severe, it can be a result of some underlying pathology like endometriosis or fibroids or anything. So please do see your gynec. Question number 5. Is intermenstrual spotting normal? Intermenstrual spotting means any amount of spotting or bleeding that you experience between your 2 periods during your regular days. Now this is completely abnormal. This can happen like at any time or during specific activities like you having sex or when you pee or something like that. Then any of this is abnormal. It can be a result of you having a vaginal mass or a cervical polyp or anything like that. So again, please do see your gynec. Thank you so much. I feel you learned something from this video, you got some information. If you liked it, please hit the like button and do subscribe to my channel for watching similar videos. If you have any questions, don't forget to mention them in the comment section below. I'll try to answer them all. Thank you so much. Bye bye. See you soon.